Thank you, Amy, and thank you, Gildas Club, for having us. As Amy mentioned in the chat box, if you didn't already complete the pre-assessment from the email that Amy sent earlier, if you could click on the one in the chat box and complete that briefly, we would really appreciate it. We will send you a separate link at the end of the presentation that Dr. Geske will discuss. As Amy mentioned, both Dr. Geske and I are licensed psychologists at St. Luke's Cancer Institute. And today we're going to be discussing breast cancer survivorship becoming the healthiest me. Breast cancer treatment often comes with many side effects that affect your physical and mental well-being, but oftentimes persist well into survivorship, so along the entire cancer trajectory. And this diagram here outlines many common challenges to obtaining a good quality of life. During survivorship, there are many symptoms that are long-term effects or even late effects that come on later. These can include things such as fatigue and sleep problems, difficulty managing hot flashes and lymphedema. And many cancer survivors also experience some mood changes. These can be related to your hormone medications or even unrelated. It can be related to anxiety or fear of the cancer returning. In addition to individual residual effects, these symptoms can oftentimes lead to distress for your family or your loved ones. People can feel lonely or loss of support. Oftentimes, if you're going through treatment, you might feel like all of your support becomes really strong and people are helpful. And sometimes after treatment, that tends to lower, and sometimes that can feel really lonely, having all that support and then feeling like it goes away. Individuals can also experience a sense of uncertainty, but also hope, sometimes representing a shift in your perspective as a result of going through breast cancer treatment. Today, Dr. Geske and I are going to focus on some common challenges and some ways to address these in breast cancer survivorship. Specifically, we will be able to discuss managing some psychological distress and well-being, and some techniques to manage post-treatment health concerns, such as sleep and some behavior changes, ways to make goals for diet, exercise, to decrease alcohol use, and even smoking cessation. Along the entire breast cancer trajectory, from initial diagnosis up through years into survivorship, a majority of patients will report varying levels of at least some distress. And treatment, of course, impacts your overall quality of life. So making sure that you are making self-care a priority is imperative. For many women with breast cancer, taking care of yourself can feel like a foreign experience, but this is extremely important. Specific types of self-care can vary, but common things to focus on are making sure that you're getting enough sleep, which Dr. Geske will talk about in more detail. Having some kind of exercise routine, doing mindfulness or relaxation strategies, and really relying on your social support to help you through things. We're going to discuss a few of these categories in more detail throughout the presentation. Having breast cancer or receiving treatment is often extremely challenging, and for some, this can be even deemed a traumatic experience due to its huge impact on self-image and relationships, and due to the psychological distress and reactions that we can experience, such as sadness, anger, or intense fear towards the cancer and treatment process and what the future might hold. Levels of distress can vary from temporary sadness up to major depression. Among breast cancer patients, a large percentage will report some symptoms of depression or clinically significant distress, and up to about 32% will report major depression globally. Some warning signs of depression are a loss of interest in activities that you normally really like to do or enjoy, or feeling sad or down most days. These can be accompanied by things such as sleep problems, trouble concentrating, weight changes, and fatigue, um, all the way up to some even experience recurrent thoughts of death or wanting to harm yourself. As I noted, one of the major signs of depression is feeling like you aren't interested in doing the things that you normally like to do. That everything seems like it takes more effort, makes you feel like I just want to stay sitting and watch TV or laying in bed all day. Unfortunately, this makes your mood worse and the depression worse. Something that is really helpful but can be difficult to do if you're experiencing depression is pushing yourself to engage in activities that make you feel calm, joy, or productive. And trying to make that part of your daily routine can be really, really helpful. It can also be important to utilize social support. That can include your family or friends, attending support groups, utilizing the great services that Gildas Club offers. Journaling can also be something that's very therapeutic. Our thinking patterns can take on a negative experience or negative spin when we're feeling depressed. And getting your thoughts on paper can sometimes help us get a different or lighter perspective. And of course, reaching out to a mental health professional, and we'll list some of our services at the end. Before introducing anxiety and how to manage it, it's really important to highlight that some level of worry and anxiety is completely normal and, in fact, can be very helpful in our everyday lives. Worry that is hard to control or starts affecting our ability to sleep or function, affecting our ability to make decisions, that moves into an area that we want to address and come up with strategies to manage that. Anxiety is very common. Almost half of cancer patients will report significant anxiety. Um, and these can include uncontrollable thoughts, scan anxiety, so anxiety that comes around your mammograms or another scan, fear of recurrence or fear that the cancer will return, and fears of death and stigma. There is, of course, an inherent level of uncertainty when it comes to cancer and the future. And this can be really hard to manage or find ways to quiet some of those thoughts so you can continue living your life. Fortunately, we have good strategies that can help manage uncontrollable worry or anxiety that's affecting our ability to function. One thing that can be very helpful is actually to schedule worry time. This can include designating about 15 to 30 minutes per day. I always say avoid close to bedtime. We don't want this to be an alert activity that makes it hard to fall asleep. So usually earlier in the day. And this process can be helpful if you categorize your worries into two different areas. The first is controllable. Things that are within our control, we can start to problem solve strategies to try to formulate a plan or steps that can help with this. Then the other category is those that fall under uncontrollable, things outside of our control. And these definitely take a different strategy. Mindfulness is something that I'll talk about in more detail today, but can be very helpful for worries that are running around in our mind that we wouldn't have control over. And then I'm also going to talk about this process of challenging some of our anxious or negative thoughts. Well, mindfulness is a way of paying attention. It means consciously bringing awareness to our experience in the present moment without making judgments about it. Most of the time, we are on autopilot. We get caught up in our experience, we react automatically, oftentimes without great thought, especially when we're stressed. Staying consciously aware of what is happening, that is being mindful, can allow us to observe and accept what we are currently experiencing. These include things that we're experiencing in our bodies or our mind or the world around us. And mindfulness provides an opportunity for us to make more considered decisions about how to respond to something that is happening. So there are more formal practices of mindfulness. You may have heard some of the exercises. These can include things like deep breathing, body scans, different guided meditations, mindful movement like yoga, guided imagery, and practicing different meditations that are linked to self-compassion and gratitude. And then there are more informal ways to be mindful in everyday life. I would argue that we can be mindful in any situation, in any activity that we do. Um, some examples might be mindful eating. So if you're anything like me, oftentimes you're shoveling your food while you're busy doing other things. That would not be mindful eating. Mindful eating would be kind of slowly eating, trying to take in the five senses as part of your eating experience. And also slower eating gives our brain time to catch up with signaling once we're full. Walking or movement can be mindful if we're taking in our five senses and attending to each present moment. Cooking or gardening, being outside, these are other good representations. I have also listed on here some free apps that will walk you through guided meditations. So if anyone's interested, these are completely free. There are tons of other apps out there, but I always like to offer the free ones. I also know that Gilda's Club offers a lot of things surrounded by mindfulness and meditations or guided relaxation. That's a good thing to look into. And one big myth about mindfulness is that the goal is to make your mind go blank or be completely relaxed. This is nearly impossible and counter to what our brain does. Instead, it's to notice when your mind wanders, to gently bring it back to the present moment. And the goal is not complete relaxation. It can vary, but sometimes relaxation is an added bonus of these exercises. Helpful tip two is to add this as part of your daily routine. Like other behaviors that help us to feel good, it's a good thing to do each day. When we are feeling anxious or depressed, our thought processes can feel like we're wearing a mental filter that highlights things in more of a negative light. And an important notion, part of cognitive therapy, is this idea that how we think, how we feel, and how we act all interact with one another. And a good example of this is I want you to imagine that you're walking by and see a friend on the street and you wave and say hello, and that person doesn't answer. So, one reaction to this, a thought might pop up into your head: what did I do wrong? They must be mad at me. If you have that type of thought, you may feel sad or upset. You may decide to ignore them or to continue to worry about this throughout the day or longer. Now I want you to think about the same situation, but a different reaction. So imagine this happens, and the first thought that pops up into your head is, oh, they must not have seen me. They must have just been distracted. Instead of sadness, you may just feel neutral. You may be able to just let it go, or you may reach out to that person and say, hey, is everything okay, or did you see me? So again, same situation, but a different thought, a different reaction can change the way we feel and change our subsequent behavior. The good thing about this is that if we change one of these things, it oftentimes has a domino effect to improving our emotion or behavior or other thoughts. Um, Another example of using this idea is to try to challenge some anxious or negative thoughts that we may experience in depression or anxiety, or honestly just in our everyday lives. Most of the time when we have negative automatic thoughts after a stressful situation, we take them as truth. They come from our own minds, so we assume, well, that must be right. And sometimes we can even think about evidence that supports that again affects our emotion and how we're feeling and maybe even our behavior after that. This thought record walks you through a process of instead kind of looking at some of the evidence for that negative thought and trying to come up with an alternative or more balanced thought that then can oftentimes lower some of those negative emotions and can be more helpful. Dr. Geske is going to go over some examples of these a little bit later in the presentation when she talks about some of the health behavior changes. After a cancer diagnosis, fear of cancer recurrence is one of the most prominent concerns for patients, and a common experience for which they seek help. Fear of cancer recurrence is defined as fear, worry, or concern relating to the possibility that cancer will come back or progress. And fear of cancer recurrence goes along a continuum from mild symptoms that just fleeting thoughts about cancer, usually with external reminders, maybe with an upcoming medical appointment or a scan, up to more moderate or severe levels where they can feel like they're harder to control. They're happening more days than not. Um, and that they may happen even outside of triggers. And on average, about 49% of cancer survivors overall will experience this, and up to 70% of young women with breast cancer will experience moderate to severe levels of fear of cancer recurrence. Having, as I mentioned, these mild levels of fleeting thoughts about whether cancer will recur is very, very common. Usually they pass, or you can do something that helps you in that moment. Similar to the warning signs of anxiety, it becomes a problem when these thoughts feel like they're hard to manage or uncontrollable, and they start to affect your sleep or your overall quality of life. Something that's a very helpful with this, some of those mindfulness strategies that I listed before. So engaging in kind of a present centered awareness can be really helpful because of course that fear of recurrence is our mind taking us into possibilities in the future. The goal is not to remove any of the worries, but to help quiet them to the background noise or a level that feels less impairing or more managing for your quality of life. Also, going through treatment, the research literature and what patients report reveals that for breast cancer survivors, they can experience some declines in several cognitive areas. Um, the two most common things reported are trouble with concentration or attention and some memory problems. And these commonly can include things like feeling like the words just on the tip of my tongue or word finding, prioritizing tasks, or decision making difficulties. These can be true of those who fall under the category of chemo brain. So if you've undergone chemo, you may report some memory loss and thinking issues. Some people experience this during treatment, some continue to experience that over time. And the severity and persistence of these symptoms varies greatly among multiple factors. So this can include whether you're also undergoing other stressors, how much sleep you're getting, what treatment you did receive or are receiving, age, and other physical and mental health problems. Some things to do if you're managing any cognitive changes is to think about some lifestyle changes. So exercising the mind. This can include any activity that's making you think, like crossword puzzles, Sudoku. Getting lots of exercise is really helpful. Providing breaks, so giving yourself times of rest to help clear your mind before you move on to the next task. Making schedules and using alarms. If you used to just rely on your natural memory, this is a good time to say, wait, I need to write this down or I'll forget. And then optimize times when you're feeling the most alert or less fatigued. If you're fatigued or not sleeping well, this is going to make it harder. Also, one of the most common reactions to cognitive changes is frustration, right? You can't remember what you were doing. You can't remember the word. And unfortunately, when we're frustrated, this just makes it even harder to think or make decisions. Something that can be very helpful is to use deep breathing and mindfulness exercises to manage some of that frustration, to hopefully lower it so you feel like it helps you to think about that word you were thinking about or what you were looking for or the next task you were going to do. Now I am going to turn it over to Dr. Geske to discuss our other topics relating to breast cancer survivors.
Hi, everybody. Um, my name is Dr. Geske, like Dr. Harry said, and she's going to be taking over managing the slides, so you'll also hear me say next slide every once in a while. So we are going to start off by talking about managing sleep disturbances, which we categorize as trouble falling asleep, trouble staying asleep, or waking up too early. I always think it's very important to emphasize that because I think a lot of people have the misconception that insomnia is staying awake all night, not getting any sleep, or maybe getting 1 to 2 hours of sleep. But that's not the case. If it's taking you longer than normal to fall asleep, you're waking up for longer periods during the night, or waking up around 3 or 4 in the morning and not being able to go back to sleep, all of that would be consistent with insomnia or sleep disturbances. So on the next slide here, we see that sleep disturbances are very common in oncology. So about 20 to 25% of the general population will experience insomnia or some type of sleep disturbance at some point every year. We see that that is much higher in oncology patients. About 60% of individuals undergoing cancer treatment will experience sleep disturbances at some point during treatment and for up to a year after treatment. And we see that individuals with advanced cancers can experience sleep disturbances up to about 80%. Interestingly, we also see that 72% of family caregivers will also experience sleep disturbances. And so these would be good techniques for you yourself to be using, and also good techniques to be sharing with loved ones if they are also reporting issues with sleep. So why is sleep so important? Why do we care about that so much? Well, when we don't get enough sleep, we see that there are a variety of negative consequences. Individuals who experience significant sleep disturbances have higher rates of attempted suicide, are more likely to develop post-traumatic stress disorder, have higher rates of depression, have higher rates of substance use, have increased anxiety disorders, and also decreased immune functioning. This immune functioning obviously is going to be very important, especially in survivorship, because we really want your body to be focusing on healing and promoting that immune system. And if there's anything that is interfering with that ability, we really want to see if we can intervene and improve that somehow. Next slide. So I'm going to be talking about some techniques from cognitive behavioral therapy for insomnia. Cognitive behavioral therapy for insomnia is very effective as an intervention for insomnia, so much so that the National Comprehensive Cancer Network, the American College of Physicians, and the American Academy of Sleep Medicine all recommend cognitive behavioral therapy as the first-line treatment for insomnia, even before medications. We see that it consistently outperforms meds. Now, that's not to say if we try some of these interventions and you're still struggling that you wouldn't benefit from some medication, but we always want to see, can we improve something that's happening with just interventions that are pretty minimally invasive before we give you a medication that could have potential side effects. So sleep hygiene is very important within cognitive behavioral therapy for insomnia. I always like to talk about the sleep drive and really kind of tie that in with appetite. So if I were to tell you that tomorrow I'm going to have a big dinner for you, I'm going to feed you at 7 o'clock and I'm going to bring all your favorites. I'm going to have your favorite entree and your favorite salad and your favorite sides, and it's going to be a big, big meal, and I am going to feed you at 7 o'clock. And then I ask individuals, what would you do in order to prepare for that meal? Well, most people tell me I'll skip breakfast, I'll skip lunch, I'll make sure that maybe I eat breakfast, but I won't have lunch, I'll avoid snacking. And the reason that people say this is because we want to build up a good, strong appetite for that food. They want to be hungry at 7 o'clock when I give them the food, and they want to make sure that they're hungry enough to eat the entire meal, or at least as much of it as they can get. Sleep is the exact same thing. We really need to make sure that you are building up a good enough sleep drive or a sleep appetite before sleep comes. So not only are you going to be tired and ready to go to sleep at your bedtime, but you're also going to be much more likely to sleep throughout the night. There's a lot of threats to our sleep drive or our sleep appetite. And one of them is maintaining a set wake time. Most of us are very good, again, if we have been around children or raised children, making sure that they have a set bedtime and a set wake time. Well, then what happens is we start going to school, we get older, we get jobs, start having your own children, and we see that those bedtime and wake times just go out the window. And so sometimes we're going to bed at 9 o'clock, sometimes we're staying up until midnight. That's really bad for your sleep drive because now your body doesn't know what time it's supposed to be going to bed. This would be like I had you stay in LA for a couple weeks and then I flew you all the way to New York. Your sleep is going to be all over the place. And so when we do not have a set bed and wake time every day, we are instilling an artificial jet lag. And so one of the best things that you can do is start setting a bedtime and a wake time that you can stick to every day of the week. A big offender is the weekend, right? We do a very good job. I'm in bed at 9, I'm up at 6, Monday through Thursday. Friday rolls around, I want to stay up a little bit. I want to watch the news. I want to watch SNL, and I don't go to bed until 1 in the morning. Well, that's all fun until Sunday night rolls around and we're just wide awake staring at the ceiling. And so we very much want to make sure you find a bedtime and wake time that you can stick to as much as possible. And most specifically, we want to make sure that you always adhere to your wake time. So if you go to bed at 9 o'clock on Sunday night and you just can't fall asleep, you finally fall asleep around midnight, 6 a.m. rolls around, you have to get up at your wake time of 6 a.m. Most people don't like to do that. Most people say, well, I didn't get to bed until midnight, so I get to sleep in a little longer. So I might not get up till 7 or 8. Well, now I have just caused another problem for the next night, right? Because that's like I still had breakfast and my big meal's going to be at 7. It would be a much better alternative for you just to get up at 6 a.m. You might feel a little bit sluggish that day or a little bit, not as peppy. But what's going to happen is that next night, we have now built up a good, robust sleep drive, and you are going to be much more likely to fall asleep the next night. So if anything, having a night of kind of some crummy sleep can actually be really helpful in getting your sleep back on track. We also really want to make sure that you avoid caffeine. I tend to be a little bit more conservative with how long I want people to not be using caffeine before bedtime because we know that it stays in the system a lot longer than we do. And so I usually tell people really about at least 6 hours, we really want to be cutting that caffeine out. We don't want to be having a Diet Pepsi or a Coke or something like that with dinner because that's much too close to bedtime. We also really know that increasing natural light exposure, especially in the morning, can also assist with starting to regulate sleep. Napping is a big thing that some individuals also engage in that ruins your sleep drive, right? This would be like I fasted all day for my big meal at 7, and then at 4 o'clock, I got too hungry and I decided to have a bag of chips. Well, now what's going to happen is I might be a little bit hungry at 7 and I might still start eating, but I'm not going to eat nearly as much as I did. So if you have a nap, you might still fall asleep at your bedtime, but the likelihood of you not sleeping through the night has really gone quite far up. We also know from lots of research that exercising regularly, yoga, walking, light weightlifting, is very beneficial in increasing your sleep drive. Same thing with our appetite, right? If you exercise during the day, you are going to be hungrier for food. Same thing happens with sleep. If we exercise during the day, especially on a regular basis, we are going to have a much stronger appetite for sleep. The next section is stimulus control. So this is another mistake that individuals make that can impact sleep. And this honestly happens a lot during cancer treatment. So what happens is we start doing a lot of things in the bed that are not bedtime activities. So the bed and the bedroom have been conditioned for arousal rather than sleep. So this happens a lot like with college students, right? We take them to a dorm where it's the size of a closet, and we tell them, okay, you sleep here, you hang out with your friends here, and they start doing everything in bed. They sit with their friends on their bed, they do homework on their bed, they're studying on their bed, they're going to class on their beds. And what we see is that the brain starts to get very confused about what is the purpose of this bed? Are we here to relax? Are we here to study? Are we here to sleep? That can happen quite often when we're going through cancer treatment, because we might end up staying in the bed more when we're just not feeling well or we're experiencing that cancer-related fatigue. So now the brain starts to learn, hey, there's lots of things that I do in bed. I don't necessarily need to be sleeping. So we want to start getting rid of that. We want to start extinguishing that association with your brain that you can do other things in bed. We really just want to strengthen your brain's relationship with sleep and the bed. So there's a couple instructions for that. Number one is go to bed only when you're sleeping, not just when you're feeling fatigued. So again, we know the difference between cancer-related fatigue and being actually sleepy. So when we're sleepy, we're doing things like yawning, our eyes are getting kind of droopy. Cancer-related fatigue, as your doctors might have told you, is not improved with sleep. It's just a kind of an overwhelming fatigue that actually is improved with exercise. So if we're just feeling fatigued, we don't want to go to bed. We only want to go to bed when you're sleepy. And so this also applies to your bedtime. If your bedtime of 9 o'clock rolls around and you do not feel sleepy, we don't want you to lay down quite yet. If you need to stay up for another hour, we would rather you do that. But again, always get up at your wake time. We also always want to use the bed and the bedroom only for sleeping and maybe sex. So again, we don't want to be reading in the bed, doing work in the bed, just kind of hanging out and visiting with our spouse in the bed. We really want to strengthen that association that the bed is only for sleeping. The third rule is if you cannot sleep, get out of bed. This happens a lot if you have middle of the night wakenings. People will wake up, they're in their nice comfy bed and think, if I just lay here for a little bit, I can eventually fall back to sleep. 15 minutes turns into an hour, turns into 2 hours, and pretty soon starting to get kind of blue outside because the light's coming up. What we would really rather you do is just get out of the bed and go burn off some energy. Go do something boring or relaxing, unload the dishwasher, fold laundry, prep your meal for the next day. This is going to be very helpful because, again, it breaks that connection between being in the bed and being awake. And it also starts to burn off some energy, and the likelihood of you getting tired and wanting to go back to sleep is going to be much higher. So it sounds counterintuitive, but getting out of bed is very effective. And again, wake up at the same day, same time every day, and no napping. We also know that counter-arousal can be very helpful. Dr. Harry talked quite a bit about some of the techniques for anxiety. We see that sleepiness can be masked by anxiety. If our sympathetic nervous system that houses our anxiety is activated, we're not going to feel sleepy. So we would really encourage you to try those techniques like the worry time and the relaxation that Dr. Harry talked about, and also create a buffer zone. About an hour before bed, we really want you to be scheduling time for unwinding activities. We as adults have a bad habit of we go to work, we come home, we cook our food, we take care of the kids, we get our chores done, we watch TV, and then we get in bed, and then we lay there thinking, why can't I fall asleep? Well, there was no relaxation that took place there. You really want to be doing something that's very calming and relaxing, just like we would do for children, right? We're going to read a story, we're going to get in our pajamas, we are going to dim the lights. Really, we really want to be very similar to what we would do for children because it's a very beneficial technique. And so these are some of the things that you can do, again, creating a nest. Dr. Harry might have to click about 5 times because I forgot that these are, there we go. So activating your 5 senses can also be very good. So having certain sounds, music, audiobooks, lights via sight, dimming, turning off electronics, specific tastes, again, things that you might only get in the evening, like a sleepy time tea or a light snack. Touch, kind of activating touch with lotions, water with a shower or a bath, PJs, special sheets, and then smell with lotions, candles, and diffusers. And these are all giving our brain lots of signals that sleep is coming, get ready, pretty soon we're gonna go to sleep, be ready for it. Our next section is succeeding with diet and exercise. So what we see is that there are some pretty specific exercise and diet recommendations. So for aerobic activity, which is cardio, the American Heart Association recommends 150 minutes of moderate intensity. Low intensity would be that you can do it and you can talk and you don't have any issues. Moderate intensity is you can still do that activity, you can still talk, but you're maybe having a little bit more difficulty, right? So that doesn't mean it's so hard that we can't even catch our breath or speak to someone. It's just that we could still talk with someone, but maybe not as easily. And then for anaerobic activity, which is weightlifting, that's recommended at 2 times a week in all major muscle groups. And then for alcohol, the limit is 1 drink a day for women and 2 drinks a day for men. And then I really like this food pyramid over here. And it kind of breaks down how many times a month you should actually be having these things. So it kind of mentions that meat should be more on a monthly basis. Your fish and your poultry and eggs should be more on a weekly basis. And then obviously, your vegetables and fruits and some of the other items should be more on a daily basis. So I always like the statement of failing to plan is planning to fail. The reason that exercise and diet are so important in cancer prevention is, especially with exercise, we do know that there is quite a lot of benefit that our body gets from exercise. We see that exercising can decrease estrogen levels in your blood, which if you have a hormone positive cancer can be very beneficial. We also see it exercising helps you digest nutrients, and we see that it helps decrease inflammation and boost immune functioning. And then obviously if we're getting lots of vitamins and good kind of quality nutrients with our food, that's further boosting our immune system and decreasing inflammation. And so this is why making a plan for increasing a healthy diet and exercise is always very important, because if we just go with this, oh, I'll just eat better, we're probably not going to be that successful because we don't have a specific plan to follow. So I really like the SMART goals. Again, a lot of times we set ourselves up by really kind of creating these loose, non-specific goals. And so we really want to set ourselves up for success. So the 5 areas in the SMART goals are specific, measurable, achievable, realistic, and timely. And I always have people who come into my office, and the very first one that they seem to struggle with is setting a goal that's specific and measurable. So specific is, again, identify what it is you would exactly like to do for your diet and our exercise, and make sure that it's trackable. So I have a lot of people who will say, okay, well, I just want to be healthier. Okay, well, be healthier is such a broad, it's just a broad statement. How are we going to track that and make sure that you're actually achieving that goal? So a poor goal would be to lose weight or eat better. We want to be very specific and really identify what exactly you want to do. So this person might identify, I'm going to do yoga 3 times a week, and I'm going to have a vegetable side with my dinners Sunday to Thursday. These are very specific and measurable goals. And then we want to make sure that they're also achievable and realistic. Always ask yourself, is this doable? Is this reasonable? Can I maintain this level of activity or intensity for the next week, the next month, the next year? And if the answer is no, that goal is not reasonable, right? If I say I'm going to get up at 5 in the morning and I'm going to run 4 miles every day of the week, all 7 days, I know I'm not going to do that. That's not realistic. I'm not going to get up at 5 a.m. on a weekend. And so we always really want to ask ourselves and really be honest, is this something that I can maintain? Always remember to start small, set small, reasonable, and manageable goals. I always like to ask myself, what is the smallest step possible? What's the smallest thing that I could do to work towards eating better, being healthier? And then lay out a plan. We want to write it on the calendar, set an alarm on our phone, find a buddy. I have a lot of people who are like, okay, well, I'm going to start exercising. I'll exercise 4 days a week, but then they don't specify when. Are we going to work out in the morning? Is it going to be after work? And what happens is life takes over. We get busy with work and with kids and with families. And so it gets pushed off, pushed off, pushed off until it's 9 o'clock at night. And now we don't feel like it. So if it's left for us to just remember or find time later, it's likely not going to happen. We really want that built into some type of schedule. It also really helps to be consistent. If we're doing something at the same time, this makes it part of our routine and it's easier for us to remember. Always also good to be prepared. So make sure that you have everything you need laid out and ready. So for a while before the pandemic, I had a workout buddy and she and I were pretty good about working out in the morning, and I would actually go to sleep in my workout clothes. Wasn't always the most comfortable, but it definitely kind of helped me be prepared, or at least I had those ready and in the bathroom. Right now I'm trying to be more healthy by drinking some smoothies, and I know that I tend to rush in the morning, so I make those the night before and put them in the fridge so they're just there and ready for me to go. We always want to look for small ways to make ourselves more successful. And then also track your progress. Tracking our progress really can show us what kind of movement we're making in the right direction. So keep track of your mood, keep track of your energy levels, keep track of fatigue, and realize that time takes change. You know, we didn't get here overnight, so we're not going to get to a healthy place overnight. And also manage our hopes and expectations, right? I'm not going to lose 10 pounds overnight. I might be able to lose a pound or two a week. And then also, I like always tracking non-scale victories. I think a lot of people get very focused on the scale. So that's why I really like tracking other things like our energy level, our fatigue, even monitoring our sleep. So we can really make sure that we can see some of these other things happening in real time. And also, you know, Dr. Harry mentioned this before, we really want to watch our own thoughts, because our own thoughts can really get into our way and make it difficult to succeed. So this is an individual who is struggling to lose weight. You know, so where were they? They were weighing themselves and they didn't lose any weight this week. They felt sad 90% and frustrated 70%. They had thoughts of, this is too hard. I'm never going to reach my goal. I don't even know why I'm doing this, on and on. These are a lot of negative thoughts. And so whenever you do one of these worksheets, we always just want to pick one thought and work with each of those by themselves. So this person chose, I'm never going to reach my goal. Well, we look at, okay, what's the evidence that supports that? I've tried to lose weight before and I haven't been successful. Losing weight is impossible since I'm taking the hormone blocker. I didn't lose any weight this week. That's all the evidence that supports this thought. This is usually the kind of the column that we get stuck in, and we never really look at, well, what's the evidence against that thought? And so once we start prompting this person, they might identify, well, I did lose 2 pounds last week and 1 pound the week before. And now that we're talking about it, I have been doing more strength training, so I could possibly be building up more muscle. I also didn't gain any weight, and I know that plateaus are normal. I have been sticking to my exercise routine and meal plan, and I actually do feel my mood feels better and my fatigue feels better. And my goal this time is a lot more manageable than I've set in the past. So this person's alternative thought might be, just because I hit a plateau doesn't mean I won't make my goal. Or a bump in the road doesn't mean that I should just get up. This person might still feel 20% sad and 30% frustrated, but now we see that we're not kicking you into kind of a real depressed or anxious space, right? Because a lot of times when we feel guilty, when we feel depressed, when we feel anxious, we feel like we're not being successful, we tend to go back on bad habits and maybe start eating poorly or skip working out. So checking these thoughts can really be good to kind of check our emotions and really kind of help us reset. A really helpful app that you can use to track your diet is a food tracking app called Chronometer. Lucas Schubert is one of our individuals here at St. Luke's who runs the Food as Medicine program, and he recommended this to me. I like it a lot because not only does it track your energy, protein, and carbs and fat, it also tracks a lot of the other nutrients, like all these vitamins down here. And so I honestly like this because then I'm not just focused on calories, I'm actually focused on enhancing my intake of good vitamins. And on the next slide, this is also a fitness app that Lucas recommended called GFit. And then he also recommends an app called Cooking Skills. And it's at thekitchen.com. And then I use an app called MyFitnessPal. And so all of these, if you were looking to kind of adjust your diet or work on exercise, all of these would be good for tracking your progress and also giving kind of some helpful hints and techniques at ways to be more successful. And alcohol and smoking. On the next slide, we can see here, again, recommendations for women: 1 drink a day, men 2 drinks a day, and no level of cigarette smoking is safe. The reason that we really don't like drinking a lot of alcohol is it increases inflammation, it increases levels of estrogen in your blood, and also when alcohol is broken down, one of the chemicals that is created is a known carcinogen. And so if we're talking about survivorship and preventing recurrence, minimizing alcohol and completely abstaining from cigarette smoking are very good ways for us to mitigate that risk. So a couple techniques that are good for both alcohol and tobacco cessation is writing down a goal for your alcohol and tobacco use. Are you going to be, again, specific and measurable? Are we going to cut back? Are we going to stop? And then write the day that you plan to make this change so we can actually get ready for that. This is also a good time to write down why you have chosen this goal. I really like writing letters to yourself, right? Writing, here's why I value this, here's why I think this is important. And also take the time to write down any triggers or barriers that might stand in your way, and then begin to formulate strategies for combating these. We see that people who identify barriers ahead of time and create goals for how to overcome those barriers are a lot more successful. And also people who are just aware of their triggers and plan for what to do are also more successful. If we just say, well, I'll just have a trigger and I just won't do it, that's again not going to be super helpful. We also see that just by tracking our intake of alcohol and tobacco really enhances our awareness of how much we're actually using and can also just help us reduce our intake. And this scale I really like down here tells you about your mood as well, because again, I think especially with alcohol, our mood can be impacted and we might not even recognize it. Another good strategy is to keep tobacco and alcohol in a different location. So this makes it less accessible and less visible, right? So if you're someone who smokes, I know a lot of smokers who kind of just keep their cigarette pack with them at all times, who would really want to put that somewhere, because cravings don't really last that long. For cigarettes, they last about 2 to 3 minutes, right? So if you keep your cigarettes, downstairs in a locked cabinet and you have a craving, by the time we would even get to it, it's very likely that that craving would be over. Another good technique is to delay engaging in a cigarette or a drink. So for example, let's say that you usually have an urge to drink when you get home from work, right? You usually get home from work, you take off all of your clothes, wash your hands because we're in a pandemic, and then kind of open the beer or open the fridge and kind of pour yourself a beer or a glass of wine. What I would want you to do is just delay that by a couple minutes, right? Delay having that cigarette or having that first drink by 20 minutes, 10 minutes, 20 minutes, and really extend that. That's really helpful in reducing withdrawal effects and with managing cravings. Then also plan an activity to do in those minutes, right? If we get home and I immediately want a glass of wine, instead I'm going to take my dogs for a walk. And then if I get home and I still want to drink, then I can have one. But at least I did not actively engage with that craving. It really dulls and weakens those cravings over time. If you are going to establish just a flat out quit day, which we would highly recommend that you do, especially with tobacco, and alcohol would be beneficial as well, Really plan your alcohol or tobacco so you're going to run out on your quit day, right? We don't want, oh, it's quit day and I still have half a case of beer in the fridge or half a pack of cigarettes. We really want it to just kind of be completely gone from the house. And then you want to remove all the alcohol and tobacco related products from your home, right? Lighters, ashtrays, liquor cabinets, cleaning up your smoking areas, really just eliminating as many triggers and visual reminders as possible. And also make sure that you stock up on your substitutes. So gum, mints, candies, low-calorie foods, toothpicks, straws, really anything that you think would be helpful as a substitute if you were to be decreasing tobacco and alcohol, right? Some people, when they decrease alcohol, like to have non-alcoholic beer around. And so whatever you think would be beneficial, let's bring in those substitutes so we don't just have an empty fridge or anything, we don't have anything to turn to instead. Also create a list of distracting interests and hobbies, and also consider joining a support group or creating a list of supportive people. And remember, with coping with withdrawal, if you have been a heavy alcohol user or smoker, we may be in for some withdrawal symptoms. For nicotine, most symptoms start about 1 to 2 days after you stop and are worst in the first week and then subside. Heavy drinkers should always consult with medical providers before stopping. But again, let's make a plan for how to cope with those withdrawal symptoms. If we're irritable, let's exercise, do mindfulness techniques. If we're depressed, let's plan an activity or organize support. If we're fatigued, allow more time for sleep or exercise. Really just go through, if I've stopped before, what withdrawal symptoms have I had and how can I mitigate those? Then some people also benefit from medication. So if you find that quitting has been difficult with nicotine in the past, there are several replacement therapies. And we also see that the antidepressant bupropion can also be helpful with quitting. And again, if you have been a heavy alcohol user and you wonder if you might benefit from a medication for alcohol, we always recommend that you consult with your medical team first. Here's an example of a CBT thought record for somebody who maybe is trying to quit. In a way, we want to get rid of those negative thoughts. So they're cooking dinner at the end of the day, they feel annoyed, 80% upset, anxious, and they have the thought, I've had a long day, I deserve to have a glass of wine. I won't be able to relax if I don't. Well, let's challenge that relaxing thought. And the thought is, well, I usually just feel better after a glass of wine. But the evidence against that is I feel relaxed doing other activities too. While I may feel immediately better, later I often feel guilty. I also know I don't sleep as well. I also know I feel anxious the next morning. So the alternative thought might be, I can find other ways to relax without wine, and I'm learning new ways to relax that will be better for me in the long run. So this person might still feel annoyed, upset, or anxious, but to less extent than before, and they'll be more likely to engage in these alternative coping strategies. And here are some apps that I recommend for alcohol and smoking cessation. Drinker's Helper is a really good app that I've just recently found that's built off of cognitive behavioral therapy techniques. So it helps you monitor your drinking, understand your triggers. It uses a community to help you build insight and success. It has some skill building techniques and also a support group, but that's at cost. It's about $9 a month, which if you think about it, that would almost be about the same as eliminating one night of drinking. There's also another app called Quit Genius, and that has a research study that reported increased motivation to quit smoking and a willingness to continue using this app after the study. That cost is about $6 a week. And if you're interested in smoking cessation, there's a free workbook that the VA has put out that is very good, and we've put that link here as well. And as always, if you try these techniques for anxiety or depression or sleep or alcohol and smoking cessation, and you just really find that you're still struggling, it would probably be best for you to meet with a mental health provider so we can maybe do some more discussion about where is this coming from and some more specific techniques to help. I myself am located at the Plaza and also see patients at East. We're offering lots of video visits with the pandemic. Dr. Harry covers Liberty and South on Mondays, and she's also at the Plaza and offering video visits. Our supportive services line is where you can reach us the easiest for scheduling, and we offer individual and group therapies. And now we will open for questions.